Hi everyone, and welcome to Healthwatch. I'm your host, Carolyn Wilson from Ledgelight Health District. The goal of this program is to bring you a wide range of interesting health topics and to introduce you to the people doing great work across the community. Today, I am joined by two guests, Cindy Barry from Ledgelight Health District and Mick Bolduc from the Connecticut Department of Public Health. And today we're going to be talking about immunizations. Cindy and Mick, welcome to the show.
Thank you.
Thank you.
So Cindy, let's start with you. As many of our viewers probably know, Cindy hosted Healthwatch for 20 years. I recently took over the show, and she's also coordinated various programs at Ledgelight Health District, but she is currently serving as the immunization coordinator. Cindy, so happy to have you back. We're trying out a new format today. This is really interesting. I'm in the studio and you're on Zoom. I want to start off by reaching out to our members, our viewers today. Your main focus right now is immunizations. What other programs have you been working on lately?
So I oversee a number of programs. The Immunization Action Program is the one that you mentioned. I also am very fortunate to be involved in our diabetes program. So I do a Live Well program. We also started a cooking program for adults with diabetes. But I also dabble in a lot of other public health topics like Lyme disease and asthma.
Excellent. Well, it's great to have you back. I know you're very busy. Thank you for being here. So as you mentioned, this past year, Ledgelight has started the Southeastern Connecticut Immunization Action Program. Tell us a little bit about the program and how it's funded.
Sure. So in August of 2020, so not very long ago, we were given the opportunity to apply for a Department of Public Health grant to really see if we could reduce the number of children who have not been vaccinated. So our goal is to increase the rates of vaccine among children and really across the lifespan. This gives us the opportunity to round out our communicable disease department at Ledgelight, to broaden our reach into different communities, also work with some incredible new partners in the community, and also to work a little more closely with the Department of Public Health.
Excellent. So how is the program building awareness in the community about immunizations?
So some of the things that we do are really to go out into the community and to talk about how vaccines work. Why they're important, the fact that they're safe and very effective. When you think about it, vaccination is extremely effective with most childhood vaccines, about 85 to 95% effective, which is really great. And when you think about it, public health is really, vaccine is really one of public health's greatest global achievements. It's estimated, and Mick can kind of verify this, but it's estimated that vaccine really saves about 2 to 3 million lives a year. Viruses and bacteria that we used to think as common are now relatively rare because of vaccines. So we're out in the community, we're really working with different populations, answering questions. We have a lot of different campaigns. It's really exciting work.
Terrific. I love that. Whenever I can get out into the community, it's a good day for sure. And we haven't been doing a lot of that. So looking forward to hearing more about this. So I understand, like many of the things that we do in public health, we've created a coalition to address immunization rates in Southeastern Connecticut. Can you tell me about what the coalition is going to be working on?
Yes, so the coalition is made up of parents, of school folks, of nurses and doctors in the community, and also some of our social service agencies that actually, are on the front lines working with people in neighborhoods and different community groups. And they've put together a strategic plan for the year. It includes some national observance days and weeks that they'll be working on different media campaigns and education campaigns out in the community. Also enrolling children into the CT.Wiz, which is the state immunization system that can keep track of vaccines among children. And then also they'll be doing a lot of pop-up events, which are really fun out in the community. So you may see us out in the community, and it's a great time for people just to ask questions that they might have either about the COVID vaccine or other vaccines that we have in our community.
That's terrific. And I understand that there's going to be some awareness campaigns. Can you tell me about what we have planned for this coming year?
Yeah, so this is August is National Immunization Awareness Month. And this is a time where we are, like I said, we'll be out in the communities. You can find us at farmers markets and any kind of events. Groton City Day, for example, will be there. And it's really our opportunity to get out and about, working with folks. We also have a large media campaign that we're going to be launching with churches, with schools, social service agencies, and healthcare providers. And for the first time ever, I think you know this, Carolyn, Ledgelight Health District is launching our monthly newsletter, which will be available for the community. So there'll be a great article in there about vaccines, about how they work, because I think that's one of our missions, right? To tell people how they work, how our body works to fight viruses and bacteria, and how vaccinations can really help us, because sometimes our bodies haven't been exposed to something before. Sometimes we just can't fight off a virus or a bacteria, and we need a little help from a vaccine, which helps us create those antibodies, right? So that when we come in contact with a viral agent or bacteria, our body already has the wherewithal kind of to fight that virus or bacteria. So, you'll see us out in the community a lot in August, and really check out our website. We're beefing it up with all kinds of campaign information. It's llhd.org, so people can find us there. So that's August, and we're really celebrating vaccine and how tremendous it's been for the residents of our community.
Excellent, great. And I know that one of the issues with all of this is the fact that during the pandemic, a lot of regular health screenings and checkups and vaccinations kind of got put on hold. So it's a really great time for us to be talking about this. Now, you did mention that August is Immunization Awareness Month. Where should people be looking for campaign information?
So we're sending campaign information out to all churches and social service agencies. So you'll be seeing posters around, and all those posters will have we'll have links to more information. For example, if you're really interested in the measles vaccine, or you're interested in the HPV vaccine, we're going to give you links and information about those specific vaccines. But it's also going to give people an opportunity to see these messages in many different places, which will really enforce how important vaccines are.
That's amazing. Cindy, I can't thank you enough for being here today. It's great to catch up with you and hear about this program. And we're going to take a quick break, actually, and we hope you'll join us right back here on Healthwatch.
As the COVID-19 vaccines become available, you might be asking yourself, should I get it? And if I do, will I be able to go about life without putting my family at risk? You've got questions, and that's normal. The fact is, the vaccines are safe and effective. They're going to save lives. To get the latest on the COVID-19 vaccines, visit getvaccineanswers.org, because getting back to the moments we miss starts with getting informed. It's up to you.
Hi everyone, welcome back to Healthwatch. Today I'm joined by two guests, Cindy Barry from Ledgelight Health District and Mick Bolduc from the Connecticut Department of Public Health, and we are talking about immunizations, especially for kids. Welcome back, welcome back. So the first half of our show today, we talked to Cindy, our former host and busy program coordinator at Ledgelight. I want to switch gears right now and talk with Mick from the Connecticut Department of Public Health. Mick, you and I have never met. We've really never talked. I'd love to get to know you a little bit more. Tell me about yourself and what led you to a career in public health.
Well, I've been working for the immunization program for the past 30 years now, and I am the vaccine coordinator. So I oversee the Connecticut vaccine program, and our main goal at the Connecticut vaccine program is to really focus right now on vaccine preventable diseases for children. But as Cindy mentioned earlier, that really extends beyond children. We're trying to not only look at getting children the vaccines they need in a timely fashion, but also adults as well, because vaccines really do transcend upon children and go across the lifespan. So as you can imagine, over the course of the past year and a half with the pandemic, we've been focused on COVID vaccines as well, but we also want to remind people that childhood vaccines and adult vaccines especially have kind of taken a back seat, and so we need to focus on those as well.
Absolutely. Very important work. You know, we can't talk about anything these days without talking about COVID-19. And there's been a lot of emphasis on that vaccine and making sure everyone's eligible to receive one and gets vaccinated. But what about the routine vaccinations? I've heard that, as I was mentioning before the break, that several children may have fallen behind on their vaccine schedule just because of, you know, staying at home and maybe staying out of the doctor's office.
Yeah, we have seen that both on a national level and also here in Connecticut, and it's not a surprise. You know, parents want to do the right thing, and they have been staying home, especially during the early months of the pandemic, and so that's caused children to fall behind on their routine vaccinations. It's caused adolescents especially to fall behind on their vaccines, and so now is the perfect opportunity. We have this window of opportunity now during the summer months to get kids caught up. And so, especially with the 12 and older now being able to get the COVID vaccines, one of the questions that we get is the spacing and the timing of the vaccines. Can COVID vaccine be given at the same time as other childhood vaccines? And they can be given at the same time. There is no spacing limitation. So if a adolescent is going in for an HPV vaccine, or they're going in for a meningococcal vaccine or Tdap vaccine, they can get those at the same time as the COVID vaccine. So we have this window of opportunity during the summer months really to take advantage of this time to get kids caught back up. They're going to need vaccines to get back into school. School is going to be going back into session before we know it. It seems like it just ended, but it's not that far off. Schools are going to be starting back up in about a month, 6 weeks worth of time, and kids do need this window of opportunity to get caught back up. The adolescents, especially as I mentioned, are behind schedule on their HPV, they're behind schedule on their Tdap and the meningococcal. Younger kids especially are behind schedule on their MMR, on their DTaP, on their hepatitis B vaccines especially. So we have this opportunity now. Cindy mentioned August is National Immunization Awareness Month. There's going to be a lot of opportunities there. Pediatricians especially are going to be having opportunities to get kids back into the office. So we really need to make sure that kids get these vaccines so that when school starts, they are up to date, so they're not kept out of school. They've fallen behind. We hear lots of stories about how kids missed out on opportunities and distance learning. We don't want to see kids missing school because they did not get their vaccination. So let's take advantage of this opportunity during the summer months to get these kids back into the office and get them the vaccines that they need.
Absolutely. I'm learning a lot today, clearly. So over the past few years, there's been a lot of attention placed on routine vaccines, especially the ones that you get in the first 2 years of life. How is that schedule determined and by whom?
So the schedule is determined on a national level by the Advisory Committee on Immunization Practices, and they meet pre-pandemic. They would meet usually three times a year, and they would determine the schedule, and they would look at new vaccines as well. But on a yearly basis, they come up with the routine childhood immunization schedule. They also come up with the adult immunization schedule, and they come up with a catch-up schedule for kids who may be behind schedule. And they meet on a national level. They're made up of nurses and of doctors and academia, and they look at the schedule and they determine what is the best way to get kids safely vaccinated, but in the quickest amount of time so that they are vaccinated with the vaccines that they need to give them the ultimate level of protection. And that's the idea, because with a lot of these vaccines, one dose is not going to give them the protection that they need. So if they need multiple doses in a series, you want to get those number of doses completed in the quickest amount of time. So they determine what is the safest way to do that, and they come up with a yearly schedule. Each year they look at that schedule. If there are any adjustments that need to be done to that schedule, they do that on a yearly basis. And then, as I mentioned, if there's any new vaccines that do get licensed, they will look at that and they will add that to the schedule. They do that also with, as I mentioned, for adults as well. And then if there are any children that are behind schedule or adults that are behind schedule, they do come up with a catch-up schedule. So that is online. You can look that up so that pediatricians, family practitioners, anyone really can go online and look at the schedules that are set on a yearly basis by the advisory committees.
Thank you for that. That's really helpful to a lot of people, I'm sure. So we hear a lot about vaccines being recognized as one of the greatest public health achievements, and that they're vaccines for diseases that we don't even hear about anymore, like polio, for example. Some people say, we don't even have polio. Why do we need to keep vaccinating for it? And what would happen if we stopped doing that?
Well, I think we saw a little bit of that last year and the year before that, when there was a large-scale measles outbreak not too far from us in New York State. So if we stop vaccinating, that's exactly what would happen, is that we would see these diseases come back. We don't hear about a lot about these diseases because of the fact that public health is prevention. We keep vaccinating so that we don't see these diseases come back. We don't have polio in a lot of parts of the world, and it's almost eradicated. And hopefully in the not too distant future, we won't have to vaccinate anymore. Polio is down to the point where there's only a few countries in the world where there is endemic polio still. And if we can get to that point where we can eliminate polio from those last remaining countries, then hopefully in the not too distant future, we won't have to give polio vaccine to our children anymore. But as everyone knows, polio is just a plane ride away. So if we stop vaccinating right now, polio is still a possibility. So that's why we have to keep on giving polio vaccine. We don't want to have these large-scale outbreaks, especially now with COVID. So we can't let our guard down. Public health is about protecting everyone. It's not just protecting your child or the individual child. It's about protecting everyone's child. So we have to have these laws in place to protect everyone in a school setting, everyone in a daycare setting, everyone in a college setting. And the laws work. We are doing a good job. We don't see large-scale outbreaks in Connecticut because we have these protections in place, because we keep on vaccinating children. We keep on vaccinating college students and children in daycare. So we don't see a lot of of these diseases because we keep vaccinating.
That's a really, really good point, and very important public health lesson, I should say. So, given that we are in the midst of the COVID-19 pandemic, it's not over. What are some of the lessons we've learned, and how can we, apply them to the vaccination program?
Well, I think there's a lot of lessons to be learned, but I think one of the biggest lessons is that we can't let our guard down. I think if anything, what this has taught us is that we didn't have a vaccine for COVID, and you saw what happened, unfortunately. Before we had the advent of these vaccines that have now come out, and fortunately now we've been able to vaccinate a lot of our population. But in the interim, 600,000 Americans unfortunately have died. And this is what happens when we have an illness, a disease that comes, and we don't have a vaccine for it. And so we have vaccines for a lot of these vaccine preventable diseases. We have to take advantage of those. We have to get our population vaccinated when we have the tools that we have available to us. And I'll bring up flu, for example, because flu season is just around the corner. And we're going to start hearing about the need to get a flu vaccine in the not too distant future. So flu vaccine will start to become available in August, and in September, you're going to start to hear the need for everyone to get a flu vaccine. Unfortunately, in the United States, only about 50% of us on a yearly basis get a flu vaccine, and everyone 6 months of age and older is eligible to get a yearly flu vaccine, but only half the population does. And there's really no reason for it. We hear a lot of reasons, a lot of excuses why people don't get a flu vaccine. I've gotten the flu shot before and I got the flu from it. The flu is not that serious of an illness. There's a million different excuses as to why people don't get the flu vaccine. None of them are really good excuses. People need to be vaccinated against the flu. And we need to do a better job of conveying the message to folks why it's important, why they get a yearly flu shot. 50% just is not a good enough percentage for us. We need to do a better job in the state of Connecticut. We need to do a better job as a nation of vaccinating people against the flu vaccine.
Thank you for that. I hope people are hearing that, and I wonder if the rates will go up this year for flu vaccines. I wonder if with COVID people are taking that more seriously this year. So really briefly, just about the role of DPH in the vaccine program. How are they working to promote vaccines?
Well, specifically, DPH, our job is to keep people healthy. And within the immunization program, we're dealing with vaccine preventable diseases. And so our focus has been, really on the pandemic. And since the advent of these vaccines in December of 2020, really trying to get the vaccines accessible to the population and get people vaccinated against COVID. Over the course of the last 7 or 8 months. Prior to the pandemic, our job really in the immunizations program specifically was really with vaccine preventable diseases and focused on children, but also across, as we had mentioned previously, across the lifespan. So that work is going to continue. Unfortunately, COVID's not going away anytime soon. So we'll have to see how this plays out over the course of the next couple of years. But, vaccine preventable diseases, we're going to be continuing to focus on those and, working with our partners, working with Cindy, working with other immunization coordinators throughout the state of Connecticut to increase immunization rates. Our rates are good. We have some of the highest immunization rates in the country for childhood vaccines, but, even 80% is not good enough. That means 20% of our children are not fully vaccinated. So we still have a lot of work that has to be done.
Great. Now, we only have about a minute left, but I know there's a couple of really important pieces of information I want to ask. Really quickly, where can people go to find out their children's immunization record?
So if a parent or a guardian needs to get a copy of their child's immunization record, they can call our immunization program main number, which is 860-509-7929. Weekdays, Monday through Friday, 8:30 to 4:30, and they can request to have a copy mailed or faxed to them.
Excellent. And also really quick, what's the #1 source of the best information to get about vaccines in your opinion?
They can go to our website, which is the Department of Public Health Connecticut website is portal.ct.gov. That's portal.ct.gov. And then they can just, on the left-hand side, go to immunizations, and they can look up the CT.Wiz, which is our immunization registry, or they can look up COVID vaccines or the Connecticut vaccine program.
Fabulous. I can't thank you both enough for being with us today, Cindy and Mick. That's all the time we have today. Thank you so much for watching Healthwatch. We hope you'll join us next time right here on Healthwatch.